Yorkshire Terrier. The Yorkshire Terrier, more commonly known as Yorkie, is a breed of small dog belonging to the group of terriers and originating from the UK county of the same name, Yorkshire. The distinctive feature of the breed are its small size, maximum weight of 5 kilograms, and its long and silky coat of blue, gray, and fiery color. Very popular with the general public and in competitions, Yorkie is also the origin of other breeds like Silky-haired Australian Terrier, a small breed of terrier-type dog developed in Australia. Yorkies are small companion dogs. They are known to be energetic and playful dogs and subject to separation anxiety if left alone. It's therefore recommended to have another dog along with your Yorkshire Terrier. The Yorkshire Terrier has a long coat, so it's necessary to take good care of the dog. In order for it to have a shiny and silky coat and avoid knots, it's important to brush it every day and take it frequently to the groomer. Before we go further, let's consider the history of the breed. History. It was in the 19th century that the Yorkshire was born in the largest county in the United Kingdom, Yorkshire, and the surrounding area of Manchester. In the mid-19th century, Scottish workers in search of work began to settle in the Yorkshire region, bringing with them small burrows that they used to poach and rid them of pests. The Yorkie's small size allowed their owners to carry them in a bag and take them out as needed to flush rabbits out of their hole. The breeding of the dog was mainly done by miners and workers employed in cotton and wool mills in the counties of Yorkshire and Lancashire. The breed has its known origin in 3 individuals: a male named Old Crab, a female named Kitty, and another female whose name has not been retained by history. Dogs of the Paisley Terrier breed, a reduced version of the Skye Terrier, also seem to have participated in the first crosses. They were selected from Scottish Terriers and known as Yorkshire Terriers, due to the fact that the breed had actually emerged and evolved in this region. In the early days, any terrier-type dog that had a long hair with a touch of blue on the body and fawn or silver reflections on the head and legs could compete in the Yorkshire Terrier category, as long as it had shortened tail and ears. But in the late 1860s, a copy of Paisley Terrier, exhibiting typical Yorkshire traits and called Huddersfield Ben, whose owner, Mary Ann Foster, lived in Yorkshire, began to be authoritative in dog shows across the United Kingdom, where she imposed the modern type of the breed. The Yorkshire Terrier arrived in North America in 1872, and the first Yorkie to be registered at the American Kennel Club, AKC, was in 1878. Like most breeds of terriers from the late 19th century, Yorkies gradually moved away from its popular origins and primitive functions to be adopted by city dwellers and become a companion dog. Temperament. Yorkies love to get the attention of their owner. Despite its tiny size, Yorkshire Terriers have managed to keep a typical terrier temperament. The breed is a very lively, affectionate, and stubborn little dog who very much appreciates outings in nature. Like any dog, it needs to run and should not be constantly carried in the arms. The Yorkshire Terrier is very playful, yet a very good killer of mice and rats. But because of their size, Yorkshire Terriers can hardly catch larger animals, although they like to confront them. Although the dog is naturally unable to physically stop a burglar, its barking makes the breed an effective watchdog to sound the alarm. Because of its strong character, Yorkshire Terriers require a firm canine education, without being violent. It should be treated like any dog, not as a substitute for a child, or it can show signs of aggression. Most of the bites of these small dogs often come from improper training. Yorkies of keen intelligence can easily learn tricks or dog sports such as agility. Appearance. The Yorkshire Terrier is a small, long-haired dog which stands very straight. The body is compact, the back straight, and the ribs moderately curved. The hair hangs straight and evenly on each side, shared by a line that extends from the nose to the tip of the tail. On the body, the hair is of moderate length, perfectly straight and not wavy. The head trim is long, of a fawn, of more sustained color on the sides of the head, at the base of the ears, and on the muzzle where the hair is very long. The coat is dark steel blue in color, extending from the occiput to the birth of the tail. On the chest, the hair is of an intense and shiny fawn. All tawny hairs are darker at the root than in the middle, and they become even lighter at the end. The skull is rather small and flat, being neither prominent nor round. The muzzle is not long. The jaws and teeth are articulated, in perfect, regular, and complete scissors. That is, the upper incisors cover the lower ones in close contact, and are implemented well squared in relation to the jaws. The jaws are of equal length. The eyes are medium in size, dark, sparkling. They are arranged in such a way as to look straight ahead. They are not prominent. The edge of the eyelids are dark. The ears are small, V-shaped, worn straight or curved, covered with a short fawn hair. The forelimbs are straight, covered with an intense golden fawn hair that is a little lighter at the end than at the root, and does not extend higher than the elbow on the anteriors. The shoulders are well oblique. The hind limbs are straight when seen from behind, with the stifle moderately angulated. They are well covered with an intense golden fawn hair that has a lighter tone at the end than at the root, and that does not extend higher than the stifle on the posteriors. The feet are round with black nails. Health and lifespan. The lifespan of Yorkshire Terriers is up to 20 years, usually between 13 and 20 years. This is exceptional for small dogs. Small Yorkies under 3 pounds usually have a shorter lifespan, due to the fact that they are more prone to injuries and health problems such as chronic diarrhea and vomiting. As all dogs, Yorkies also have health issues. Some of them include cataracts and other eye problems, bronchitis, blockage or disorder of the lymph vessels, and portosystemic shunt, which is characterized by a bypass of blood from the gastrointestinal tract directly into the systemic circulation. In addition, Yorkshire Terriers have a fragile digestive system, which often causes the dog to experience vomiting or diarrhea resulting from the consumption of foods outside of a regular diet. Given its fragility, Yorkies are more likely to be injured by other dogs, falls, and owner clumsiness. Allergies sometimes occur and can cause hair loss, skin dryness, itchy and/or red. Teeth problems are also a concern. Like all small dog breeds, Yorkies may have dental issues if the milk teeth, also called deciduous or baby teeth, do not fall out as the adult teeth grow. In some cases, this can lead to severe dental disease. Due to the fact that the dog has a small jaw, the teeth can become crowded and may not fall out naturally, causing food and plaque to build up. Without proper care, bacteria will eventually develop on the surface of the teeth, leading to periodontal disease, with possible complications of heart and kidney problems. Yorkshire Terriers are also affected by certain genetic disorders. Among them include double eyelashes, or dystichiasis, abnormal buildup of fluid in the brain, or hydrocephalus, congenital disability of the neck, called hypoplasia of Dens, luxating patella, which is characterized by a sudden severe lameness of the limbs, a genetic eye disease affecting the retina known as retinal dysplasia, tracheal collapse characterized by a chronic, progressive, irreversible disease of the trachea, or windpipe, and bladder stones. Yorkshire Terrier puppies may experience low blood sugar, which may be the result of fasting or regular prolonged time between meals. In rare cases, the condition may continue to adulthood in very small Yorkies. Hypoglycemia is often diagnosed in Yorkie puppies at 5 to 16 weeks of age. Very tiny puppies are especially at risk of developing abnormal low blood sugar due to the fact that they have insufficient muscle mass, making it difficult to store glucose and regulate blood sugar. Thank you for watching this video till the end. Now it's your turn. What dog breeds do you have or would like us to talk about? Please let us know. Remember to like this video and subscribe to the channel to help us establish our presence on YouTube.